So moving to the next artery, which this is more of like, yeah, it's an artery. That's a costocervical trunk. So move to the costocervical trunk, and we try to look at the clinical importance of this of this artery. Okay, so costocervical trunk. So why do you study the anatomy of the costocervical trunk? First of all, you have to know the anatomy knowledge of this artery, because it's very important. Okay, surgical wise, so when you want to do all those subclavian artery surgeries, you have to know that what costocervical artery exists there, and surgeons have to be careful in catheterization, bypass graftings, and and thoracic outlets, surgeries. Okay. Then also, when you're doing any surgeries in the chest region or the neck region, then you have to be aware of this artery, because any injury could actually cause a lot of bleedings. So it's also important in neck dissections and tumor resections, where vascular preservation is actually required, so you don't want to actually cut it off. So also important in what collateral circulation, because consider what it connects with a lot of arteries in the neck, okay, and as to most of the descending branches of the occipital artery, and this provides a collateral blood supply to the cervical spine. So the supreme intercostal artery connects to the posterior intercostal arteries, contributing to collateral circulation in the upper thorax. Costocervical trunk. So anatomical variations typically arises from the second part of the subclavian artery, but sometimes may originate from the first part. So branching variations include differences in the numbers and also the sizes of branches from one individual to another.